Hello everybody, today I'm going to do a presentation on the anatomy of the abdominal wall and why it's so important to your general health and well-being and also to your recovery either after pregnancy or into abdominal surgery. So we're talking C-sections, hysterectomies, prolapse repair surgeries, anything to do with that area. There's going to be some trauma to some of this tissue, and I'm just going to explain it a little bit more so you know what's going on with your body and how you can help yourself and how I may be able to help you with the soft tissue skills and education that I've had with my women's health specialist and with my scar therapy qualifications. So when I'm checking a lady for abdominal separation, I work with the area called the linea alba. So that's this connective tissue that runs down the middle, the midline. And what I do is I'm kind of checking two things in that linea alba. I'm checking one, what's the gap? So what's the gap between the rectus abdominis? So that rectus abdominis is your six-pack muscle. That's the most superficial layer of the abdominals. And I'm going to check the gap between those two muscles, those six-pack muscles, and see how far away they are. So that's one thing. And then the second thing I'm checking is also the depth. So how far can my fingers go? I'm not too bothered about the gap. It's more about the depth. So if I can sink my fingers, if it's quite spongy and I can stick my fingers quite far through, then yeah, I'm going to want to work with you to try and strengthen up that midline and get that connective tissue strong again. So that's the linea alba. Then you've got that the most superficial muscle, which is the rectus abdominis, your six-pack muscle, and that's what I'm checking for abdominal separation. Okay, next up we've got your internal and external obliques, and another reason why I'm interested in your internal and external obliques is because they're the muscles that you use when you twist and you rotate. And sometimes if you've got a weakness in that linea alba, what can happen is that we can overuse and overactivate these oblique muscles. So we start to use those internal and external obliques for stabilization, rather than our linea alba, our transverse abdominis muscle, which I'll come to in a minute. And I can see this, so when I'm working with you and I'm getting you to do your core and pelvic floor, I can see whether you're overactivating these muscles. And then again, with my soft tissue skills, we can start the process of down training these muscles, and I give you homework to do to work on those oblique muscles as well. There's a lot that can be done at home yourself. I try and empower you and educate you to be able to do the self-care yourself, because you don't want to be coming to me all the time, maybe once a month to just keep on top of things. But ultimately, I'm wanting to empower you and give you this information so that you can keep on top of it at home yourself. So we've had your linea alba, your rectus abdominis muscle, the superficial. Then we've got your internal and external obliques. And then the really, really deep abdominal muscle is called the transverse abdominis. So I call that the TVA. So this is the muscle that I'm most interested in with regards to your core and pelvic floor. It's the deepest muscle. It kind of wraps around all the way around like your support belt, and it gives you that stability. And again, if that muscle's weak and if it's not firing up properly, then like I said, the stability then comes from the obliques. So we don't want that to happen. So I can do a few tests to see if your transverse abdominis muscle is working or not. And if it's not, then I help my ladies to start that activation process with their core and pelvic floor, and we start getting that muscle to wake up again. If there's been trauma, that tissue stretched during pregnancy, it can take a lot to then get it back functioning again. I also look if there's been any, C-sections or hysterectomies to that tissue. Then, there's going to be trauma, it's going to be stretched. It may need a little bit of more help sort of start firing up again. And then the last thing I'll talk to you about is right at the bottom, you can see like this white sheet, and it's called the aponeurosis. And the aponeurosis, we have it everywhere in the body, especially around this area and into our back. And it's very dense, fibrous connective tissue. It's very strong, it's very robust, it's there to help our muscles, and it's this fascia connective tissue. And what can happen, especially if you've had any like C-sections or any abdominal surgery in this area, what happens is this connective tissue starts to lay down fascia in all different directions to help you heal, which is great. But sometimes that can then lead to adhesions underneath the scar, around the scar, and then this starts to pull on organs and other muscles in that area, which then can cause tightness, restrictions, pain, bowel and bladder issues, back pain, hip pain, breathing strategies that aren't optimal. So then this is why scar therapy and that work comes in really well, because we want to down train that, we want to work on that tissue and make sure it's functioning to the best of its ability. So this is what I do. I help ladies to work on this whole area, this whole abdominal muscle, whole abdominal wall, get you functioning and firing up and getting all these muscles to work together in synergy. So I hope that explains a little bit more what might be going on. And if you've got anything going on, please just get in contact and I'm more than happy to help.